welcome back, listeners, to YUH with Lisa, Phil, and Aaron from California, whose arms must be tired. Haven't made that joke for a while. Thought I'd put it in. This week we are talking to Blanca E. Rodriguez. If you want to find her online, it is important to include the E because she's not the only Blanca Rodriguez. So, welcome, Blanca.
Thank you so much for having me. What a joy it is for me to be here today.
Great to have you.
Okay.
Your organization is Wounded Healer LLC. That's your business?
Yes, that's right.
And we should say that you're a certified canine massage therapist.
Ooh, cool.
There are some
Yes.
stuff that you might not be aware of when you go to the veterinarian,
Okay.
that's available also. And you're also a author and a holistic practitioner, senior massage therapist.
Yes, I'm a holistic life coach and a licensed massage therapist for the state of Florida for over 20 years, actually.
Awesome.
Mm-hmm.
Yep.
What part of Florida are you in?
I'm in Southeast Florida, 2 hours away from 2 hours north of Miami and 2 hours south from Orlando, literally.
Nice. We know they've been there a couple of times. We really like it down there. So let's maybe start off talking about the canine massage therapy. That's interesting to me. We don't have a dog at the moment,
But we did.
we did have we loved our setter.
Yeah.
Oh.
Cool.
I had a dog once. We adopted him, and it turned out he had kennel cough. And they taught us some kind of massage thing called compage, I think, where you like beat against the side of his rib cage to loosen everything up.
Yes.
But that's the extent of dog massage that I've encountered.
Yeah.
Unfortunately, that he only survived for about 3 weeks. Poor guy.
Oh, I'm sorry. Sorry to hear that. So yeah, I've been a massage therapist.
It's been about 30 years. So.
Oh, okay. It's been a while. It's been a while. So yeah, I've been a certified canine massage therapist for almost 10 years. And the interesting thing about this is that here in the state of Florida, being a canine massage therapist counts as continuing education for my licensed massage therapy license. So it's
Cool.
it was a great double whammy. I've been an animal lover ever since I can remember. I had dogs, cats, turtles, birds, you name it. And when the first side that I got the opportunity to become a canine massage therapist, I jump into it fully. It's a very powerful practice that has been around actually since 2700 BC. It's a very ancient practice, and it all started in China. Of course, the Roman Empire used to have animal massage therapists for their horses and other animals. And one of the most famous faces, well known through history, is Julius Caesar. Julius Caesar used to have epilepsy, and he used to take his massage therapist with him to war, actually. And the massage therapist used to massage his war dogs, actually. So that's one of the famous moments in animal massage therapy when it comes to history wise. But coming back here to the US, it was introduced in the early 1970s with equine massage. Horse massage therapy is much more well known here in the US than canine massage therapy or even cat massage therapy. So yes, after equine massage was introduced here in the US, then canine massage therapy came, and it's even recommended by the American Kennel Club for better quality of life for the animals involved, not either in as competition dogs, but in life in general. So it's a very, very powerful practice, and I just love to do it. It's a beautiful thing.
Now, I'm assuming canine massage therapy would pay better than cat massage therapy.
You know what? I'm not sure because I don't do cat massage. I love cats. Kitties are very special beings, but cats are honestly very unpredictable. And the last thing I would want is for a cat to bite me in the hand, and then I won't be able to work. So yeah, that's why I don't really approach cat massage therapy, but it's well known as well. I have had many people asking me, do you do cat massage therapy? I'm like, absolutely not. But there are cat massage therapists around. Yeah.
Well,
with our male cat, he basically demands a full body massage like 3 times a day.
I love
Now,
that.
my female cat, she comes up, she gently requests a massage. I massage her for about, I don't know, up to the max has been like 2 minutes. And that's not an actual measurement, that's just a mental suggestion. And
Right.
she then bites me.
Gives
Let me know we're done.
you a tip.
So she bites me and walks away. And it's
Oh,
not like a
God.
bite. It's
Too
just
cute.
mouths me to say, nope, we're done.
Yeah. Yeah. It's like a nibble. It's like nibble, nibble. I'm done with you. Don't touch me anymore. Yeah. Yeah. It's very interesting. I
I
mean,
get the chaoticness of cat massage.
definitely. So yeah, it's very interesting the practice of any kind of animal massage therapy because just like your cat that comes to you, you touch your cat for a few minutes and the cat list, it's like, okay, I am done with you. Same exact thing with canine massage therapy, actually. I have had dogs that they have stayed for a full hour being massaged, which is not the norm. And then there's other animals that they get the massage done, and when they are done, they just get up and they just walk away. Yeah, yeah.
Yeah.
That's a big difference between human massage therapy and animal massage therapy. The animal decides when they are done with their session. Very, very powerful.
Yeah.
Will a dog do you treat dogs just for well-being, like, younger dogs, puppies, or is it mostly dogs that are afflicted with some sort of malady, like Aaron?
Well, I have worked on dogs from puppies, agility, competition, um, sedentary lifestyle, because when the dog is too active or too sedentary, it can harm them equally. I have massage on dogs that they're elderly. Right now, I am massaging an elderly German Shepherd, and I am massaging two golden retrievers that they're highly active animals. And the effects of these massages are equally powerful, just like us humans that we love our massages, and it's not only for rest and relaxation, it is for many, many ailments like respiratory ailments, arthritis, dysplasia, post-surgical, pre-surgical, pre and post competition. Agility competition dogs, these dogs get hurt more than any other competition dog, that is for sure. They're so excited to do their thing that they hurt themselves tremendously, and that is when I have massage before to get them like nice and ready and pumped up for their competition, and then to calm them down after the competition. And if they get physically hurt in some way or form, that is when definitely massage therapy comes into play. So yes, it's a practice with a lot of variety. I have massage dogs that they have separation anxiety. I have here, Florida is the lightning and thunder capital of the world. So there's a lot of dogs that are terrified of the noise. And that is when a massage comes really into play. I used to massage our dog, rest in peace, that she was terrified of fireworks. And I have had doggy clients that unfortunately they get so scared with fireworks that they have had massive heart attacks and die because they get so terrified with these noises. So yeah, when let's say July the 4th is coming, New Year's Eve is coming, I used to take Daffy, put her down, and massage, especially when she started aging. She will get even more scared of the noise, and that will be a tremendous way to soothe her and calm her down for those hard moments of fireworks. Yeah.
Yeah, my grand dog gets drugged every year for the 4th of July, so
Mm-hmm.
so he
Oh,
doesn't have his freakouts.
yeah.
He's
Yeah.
a
It's hard.
he's a husky poo, half husky and half
Ah,
multi poo.
love it.
Yeah, he's beautiful. Um, do you think that the thunder wrap, the whatever, I think that's the name of it, that hugs the dog tighter for situations like that, do you think that might be somewhat of an offshoot of massage?
Well, it can be a help, definitely, but it's not the answer. to the issue or the challenge that the animal may have. Everything that can help is really more than welcome, but let's remember that one size really do not fit all, because there's so many breeds. There's over 450 different breeds of dogs out there, and definitely the lifestyle that they live at home, what is their environment at home, influences in everything that the animal is doing. Remembering that the dog is the reflection of their owner. So that's something to take under consideration seriously. That's why when I see the animal for the first time, I have a long chat conversation with the owner of the animal to see where are we going from there and which behaviors to be very aware of when it comes to approaching the animal for the first time.
That makes
Now,
sense.
one last question on this subject,
Mm-hmm.
and maybe we'll talk about something else. Do you have a preference over human versus canine?
Absolutely. Absolutely. That's without a doubt. Oh yeah. I've been a massage therapist for humans for over 20 years. But when it comes, and quite a bit of people have asked me, what do you prefer? Who do you prefer? Oh, the dog. 100%. The dog. And it's a dirty job. There's a lot of dander. There's a lot of doggies that they get so happy or so nervous that they pee on themselves, they get gassy, whatever the case may be. When there's like, for example, I had this Chihuahua. Chihuahuas they are high strung, and they are
They're
eternally
crazy little
stressed
dogs.
out. Yeah, they are eternally stressed out, anxious, and freaking out all the time. So this Chihuahua had to be put on the owner's lap so I could make an approach little by little, because the dog, well, I don't even put my hand on the dog, and the dog is screaming and barking and going all crazy. So yeah, it's challenging, definitely, but it's worth it. They are all worth it.
Didn't our
Lisa's dad's Chihuahua bit me on the calf, I remember, a couple visits ago.
Right.
Was that the Chihuahua that bit you, or
Yeah,
the Dachshund?
Chihuahua, I think.
Yeah.
Oh my God, I love dachshunds. I grew up with dachshunds, and oh my goodness, there are the smaller the dog, the higher the ego, and they will eat anybody alive. That's the thing. Yeah. I
Yeah,
love
they
them.
they usually don't know they're small dogs. That's
Oh,
the
they
thing.
don't know their size. They just want to kill everybody. Not a problem. Yep.
Did you hear about I believe it was in England, somebody decided it was a good idea to breed a dachshund with a pit bull.
Oh my Lord.
Yes.
Oh my God.
Puppies at between, I think they were like maybe 8 months old. The puppies swarmed and killed a teenager who got into their yard.
Oh my God. That is such a huge
like,
mistake.
Right. That's right up there with putting a Chihuahua and a pit bull together.
Oh my God. That's,
Like,
oh my
no,
goodness. Can you
no.
imagine? I cannot imagine, because that's such a dangerous situation.
Yeah. Pit bull,
Yeah.
golden retriever. Okay. But you would have to be such a major alpha to deal with a pit bull dachshund or a pit bull chihuahua.
Absolutely.
Just flat out.
Without a doubt. Yep.
So
Absolutely. Those are things that just better say that it's better off do not attempt ever, because the breed is separate from the other one for a very powerful reason. Yeah.
Yeah.
cross those wires and you come up with with an animal that has the attitude maybe of the smaller dog, and then
Right.
the
The
attributes of a
protectiveness
more
of the-
aggressive.
Right.
Mm-hmm.
He's able to
And
carry out
these are
these.
8-month-old puppies.
Yeah.
Oh my Lord.
Yeah, I'm sure they ended up putting down the entire litter.
Well,
Well, hopefully it didn't go further than that. And that was like a one try alone. And I don't know whoever committed this atrocity to do this. Shame on them, to be honest with you.
And really, I think there need to be, I hate to say more laws, but regulations and things like that, you know.
Absolutely.
Unfortunately, I don't think there is any real breeding oversight at all anyway.
Yeah, I don't believe so, and definitely is a shame and something to
Right.
pay very close attention to, because it can lead to the tragedy that led to already. So yeah.
So I have in my notes here. What is Toastmasters?
Toastmasters International is a
It's a public
platform,
speaking group.
is yeah, it's a public speaking platform for leadership that engages people or members in leadership and communication skills. It's all about improving our speaking. I'm an area director for Toastmasters International for the last year. I've been a member for 3 years. It's a beautiful platform that really pushes us to speak better, do better. And in every single meeting that I have ever been, which has been quite a few, there's always something new to learn. And it's in a very safe environment that you learn, no judgment, I mean, the challenges are there, but there's no judgment involved. There is 365,000 members from 145 different countries. This platform has been around for 100 years, since 1924, actually. So, and it was created actually in California. So, yes, it's a
Yeah.
powerful platform that I highly recommend to everybody. And all of us are volunteers. Definitely, this is not for profit. It's totally worth it. Mhm.
Disney has a group called Toastmasters.
Oh my God, I love that. Toastmasters, I love that.
Toastmasters. Yeah, that's great.
Mhm.
So
You have a great voice, Erin. Would you ever consider doing something like that?
I would love to. I would love to, but yeah, I'm so involved in so many things right now that is something that in the long run, definitely, I'm really contemplating it. Thank you.
Mhm.
um, so so getting back to the massage therapy, I guess
Mhm.
Lisa and I have a little
Bit of an
experience,
agenda, if
you
you
know.
will.
So
Mhm.
why don't you describe it? It's your personal
Okay.
thing, kind of.
Um, I have a few medical issues.
Hmm.
One of the first ones I found that actually helped me finally start losing a little bit of weight, and this was before I had a gastric sleeve,
Hmm.
was lymphedema. I do have
Mm.
lymphedema. I've been officially diagnosed. I also have something called necrobiosis lipoica diabeticorum. We're not going to go into the rest of that.
Hmm.
But with the lymphedema, I started getting massage therapy, but my insurance only covered so much.
Yeah.
So what we did was we had Philip come in and kind of learn how to do it. But, life happens, and just the wrapping of my legs that it required took like 45 minutes at the time. We did
Mm.
eventually go to Velcro, which is somewhat less effective. But once you wrap the legs, you lose weight. It doesn't matter whether it's Velcro or the wraps that take 45 minutes
Yeah.
a day, okay,
Mm.
out of your schedule. But so you know what happens is the wraps help to decrease fluid, and then your legs get smaller, and the wraps are no longer effective. So then they swell up again, so on and so forth.
Hmm.
That took forever. And even once we got the Velcro, it still took up some time. Then, of course, I've got the things I have to do for diabetes. And then there was kidney disease. So we had to come up with we've got the diabetic diet, we've got the kidney diet, we've got the trying to lose weight diet. So you're balancing all of those things. And then now I'm on dialysis. So that's a different
Mm.
proposition.
Yeah.
Plus, I'm being tested for Cushing's disease.
Oh well.
Mm.
So what kind of and he's pretty sure I have it. I'm on the third test.
Yeah.
Uh Based on the first two tests, he's like, "Yeah, pretty sure, but we need to do the third test and then we'll move forward." Because if we
Yeah.
don't move the third test, you can't get treatment. So what do you
How do
I
you
mean, do
fit
you
massage
how do you
therapy
fit
in with all that
massage
other?
therapy into our schedule without, I mean,
Because we were seeing
we
benefits from it, right?
we're
Yeah.
balancing and we're trying to balance so much. And then also there's the fact that he has very strong hands.
Mm.
And he's got an X, he's got that Y chromosome. So he has difficulty with me gently instructing. So then we have a tendency to get into imbalanced communication.
It happens.
So do you have any recommendations?
Well, my recommendation for a start, since you have these ailments going on, that it's a pretty serious matter. I hear diabetes, I hear lymphedema, I hear dialysis, especially with dialysis. My ex-partner, he had dialysis for the last 11 years of his life, and he abused his body a lot to get into that extreme. Okay. And definitely,
Hey,
what's that?
if I may, I do want to say that as far as that extreme goes, I I kind of want to give myself a bit of a defense there.
Mm-hmm.
A lot of people think, oh, you must eat too much. You
Mm-hmm.
don't exercise. I didn't eat too much. I was 27. I could still do cartwheels, um,
Yeah.
even though I weighed almost 300 pounds. Now, here's what's happened. And I would go dancing, the whole 9 yards. I mean,
Mm-hmm.
people were like, how do you dance like that? And I'm like, I just do. Even at 300 pounds, I could drop it like it's hot.
Yeah.
Okay. So, but all of these things, I mean, the PCOS plus possibly and probably the Cushing's disease.
Mm-hmm.
But when it comes to the kidney disease, I started developing skin infections.
Mm-hmm.
And that's part of the whole like lymphedema journey,
Yeah.
plus the
Mm-hmm.
NLD. And so I developed these infections and they were antibiotic resistant. So they had to give me an antibiotic that destroyed my kidneys. I just
Mm.
wanted to put that in there, okay?
Yeah.
Because I know a lot of people personally who are like, oh, yeah, sure, you don't eat, and I'm like, whatever.
Yeah. So what I can tell you, and this is from a professional standpoint, the
Right.
first thing that I would recommend, I'm not a doctor, I don't prescribe for none of that matter, but I am a medical massage therapist, and I have worked with quite a few patients with lymphedema, people in dialysis that they went into kidney failure, whatever the case may be. And what I have, the research that I have done myself, and this is what it goes specifically at one. I'm gonna give you I'm gonna give recommendations based on each one of these
Yeah.
challenges that are going on. Okay, in a separate. Okay,
Okay.
so massage therapy is really beneficial for people that are going through dialysis. Okay, it can improve. I mean, with massage therapy, the symptoms of fatigue, muscle cramps can be lessened with massage therapy. Now, if you're having lymphedema, well, for lymphedema, lymphatic drainage massage is the way to go with lymphedema. That is why in many hospitals, in many doctors' offices, it is approved to even be covered by insurances. Okay. Here in this, I don't know how it goes in the state of California, because the more I keep on finding out, it seems like every state in the US is like a different country with different rules. So in the
Yeah.
state of Florida,
Lisa and Phil are in Ohio, by the way.
Right.
Yeah.
so at least here in the state of Florida, massage therapy was totally eliminated from having coverage from any insurance. Why did that happen? That's a story for another day, but it's obvious that if the long-term effects of massage therapy outweigh anybody be cut open. All right.
Is that a
So,
DeSantis decision?
oh, well, I don't know, but it was all of their decision and they all messed up on that one. That's for sure. So before a few years, when I started being a massage therapist here over 20 years ago, massage was covered by insurance. Okay. Teachers had Blue Cross Blue Shield. So Blue Cross Blue Shield will cover massages for teachers. It was a lovely coverage that these teachers deserved and have. Now it's a whole different story. Nothing is covered for the reasons that whatever it is, but massage is really, really good for patients with dialysis. I have massaged quite a few of them over the course of my career. I have massaged patients with a lot of patients with lymphedema, and definitely the effects are powerful. But this is something to do on a consistent basis, and the movements to move lymph is pretty simple, to be honest with you. The first thing that happens is that massage doesn't have to be painful to be effective. It's something that everybody needs to understand and be very aware of that. I have had, I have worked on tens of thousands of people over the course of my career, and there is a little bit of a misconception between a massage that is lighter pressure and the one that is a deep tissue. If you want a deep tissue, then that is your preference, but it's not everybody's obligation to receive a deep tissue, because a lot of people, they're so highly sensitive that a deep tissue will do more harm than good. Okay, so I always start with lighter pressure, no matter what kind of massage it is, and then go from there. I recommend that you go to a professional massage therapist, because you have quite a few medical challenges going on there. And honestly, somebody that doesn't have the full knowledge of what they are doing and what is the purpose of the approach of the massage, it can do you, here we go again, it can do you more harm than good. Okay, and with lymphedema, one thing that is pretty simple, and let's pretend that my arm is the leg. This is your foot and this is your leg. Just by lifting up your legs and putting it higher up there, you do this movement from the feet all the way up to the inner thigh. Why the inner thigh? And very light pressure. You don't need to apply hard pressure for anything. If you want a little bit more pressure, that's okay, but it's depending on what the massage is for. I have done lymphatic drainage massage on people that are post liposuction. That is a whole different other ball game. Okay, when it comes to lymphedema, it's really not necessary to go deeper. So this is the foot, this is your leg, go towards your inner thigh. Why the inner thigh? Because the lymph nodes are closer to the surface in the inner thigh. Why go easy in the inner thigh? Because arteries and veins are close to the surface of the skin, and it may be bad if anybody goes to the inner thigh and presses too hard. All right. So yes, that would be definitely it. And a normal Swedish massage for patients with kidney issues will be more than welcome as well. You said you had gastric bypass?
No, I had the gastric sleeve. The gastric bypass
sleeve
scared me, and understandably.
Okay, gotcha. And for Cushing's disease, I would say definitely that a normal Swedish massage will do. And definitely for overall health, since you have lymphedema as well, lymphatic drainage massage will be the way to go. Definitely. It's a lighter pressure massage. You don't need hard pressure, because maybe your skin is pretty delicate because of what's going on with the kidneys, because your lymphedema, the skin stretches and shrinks and stretches and shrinks. So there may be some thinning of the skin, whatever the case may be. Okay. So lymphatic drainage massage will be definitely the way to go.
Okay.
Mm-hmm.
Right. So lymphatic and Swedish.
Yeah, lymphatic and Swedish. And definitely the more, and this is what I tell everybody about massage therapy. When you go to a massage therapist, if the massage therapist just puts you on the table and starts working without asking questions, beware. This may be a massage therapist that for them, one size fits all. And no, we are all individuals with individual needs. The more communication between you and your massage therapy, the better off you will be, and the more of the benefits you will receive. Because at the end of the day, it's us providing a massage to you. And the biggest rule of any massage therapist is do no harm. Okay, very, very important.
And then I have some neurodivergence also, which makes me somewhat reluctant to be touched. I'm not,
Okay.
so it's kind of, I have to really know someone to even like, offer a hug.
So
I
you
see.
you might be surprised to hear this, but Lisa's very good about giving them information during these sessions.
Yeah, that's very important. That's definitely is
And
very important.
I'm not hiding anything. I don't, I'm not embarrassed by things.
Yeah.
And I
Mm-hmm.
guess I guess that's part of my neurodivergence because other people are
Mm-hmm.
like kind of embarrassed by stuff like that. And I'm like, why?
Mm-hmm.
I just
Yeah.
get it.
Well,
Yeah,
So,
and there's nothing wrong. There's no right or wrong when it comes to it. It's like the YUH is like, no, I don't want to touch anybody. I don't want to be touched, and it's okay, and it's perfectly
right,
okay. But when when there's a medical issue that is, that is playing an important part of being touched, then it's a whole different ballgame. That is for sure. This is a service that you are receiving. It's not just touch for the heck of touching.
right.
we went
Yeah.
pretty far down the tracks on this. We
It just got to
started
the
to
point where there were finances involved too.
finances. This was before we started doing the dialysis.
Mm.
Hmm.
Time is, I mean, our weeks are flying by because we have so much. We do this 4 times a week. It's 4 hours
The
a session.
dialysis,
Oh
But
Yeah,
yeah.
they
Hmm.
do at-home dialysis.
yeah,
Oh, you do at home. Okay.
yeah. So and
which really does save some time because, we don't have the transportation issues. Because I do not drive. I have a
Okay.
phobia.
well, and we both have full-time jobs.
Right?
And
Hmm.
this is most important. We're trying to still have a life.
Of course, it's
Trying
very
to
important. Yeah.
podcast. We're trying to, like right
We're
now we're
trying to
getting
get more involved in local and state politics.
so the
You know,
massage.
Mhm.
My technique was not, I'm not a professional. I was
uh,
we were
let's
learning how to
Of
do
course,
it.
of course. Yeah. And if you're not if you're not a professional, there's only so much that you can do about it. But what I highly recommend is lighter touch is the best touch. Definitely. And from the foot up and the foot up, not going up and down and up and down. It's from the foot up and you
Right.
go back to the foot and up because that is that in that way and you can do on circles as well, but to simpler the better because since you're not a massage practitioner, the simple is always better. It doesn't matter what. And with one touch alone, going from the foot up and the foot up, the better off everything will be. If there is a little bit of lotion to be applied for consistency, that's fine, but there's no obligation to put lotion on the skin either. And what I would highly recommend is that, I mean, YouTube is YouTuber University, that is for sure. But the more I would say to you to research about lymphedema, research what it entails to help the lymphedema stay dormant, so to speak. Yeah, and definitely lymphatic drainage massage is the best way to go, and not only for lymphedema, but it can help you with all the other situations that you're going through, your diabetes, and then of course Swedish massage for your kidney failure. Definitely, yeah. Mm-hmm. And the lighter the pressure, the better, because you don't really need deep pressure because I mean, definitely your health right now is delicate. So why apply something hard when that's the last thing you need in this process?
And
Mm-hmm.
I will say about Philip, he would be great at deep tissue massage.
Oh, that would be awesome. But yeah, and definitely something else with massage therapy. I used to do massage therapy for rehab centers, and I would put people on the table for 15-minute increments. Okay. So you don't need to be a full hour massaging. You don't even need to be 30 minutes massaging. If it for the sake of time, 15 minutes is better than nothing, and it's highly effective too. Okay.
All right.
And I certainly hope that this discussion actually helps as opposed to feeling like me just getting free information.
No, absolutely. And this can help many people out there. Oh, absolutely.
You're leveraging the podcast to get some free help.
I was wondering if in Florida chiropractic is covered by insurance.
Good question.
Yes, it is. Yes, it is. But
So,
it
so
started
chiropractors, but not massage.
not massage therapy. But when I got licensed back in '05, it was chiropractic was covered, massage was covered, and all of the things that chiropractor offices do. I mean, I used to work for chiropractors for many years. That's what I did most of my time. Yes, I was always in the medical aspect of massage therapy. And yes, but till this day, chiropractic is still covered by insurance, which is, you know what? That's hope. Yeah, I'm glad that it wasn't eliminated. Yep.
My personal insurance does cover some massage therapy, but only for like six to eight like sessions.
Yeah.
And that really,
Right, there was a limit to it.
Yeah.
Right.
So-
very
And that was
limited.
That's what.
And then this is my
How often would those sessions be? Once a week? Twice a week?
well, they would want them to be like, for instance, my lymphedema, when I first started, they wanted three times a week.
So you're covered for 2 weeks.
Right.
Exactly.
Yeah. My lymphedema therapy did actually get covered for a period of time because it was lymphedema specific. Had
Yeah.
it just been massage, it would have been different. And then also they did start covering chiropractors as like a specialist. So, that was added on like 2 or 3 years ago. But when you go in, there's no chiropractors on the list. They're not going to seek out any chiropractors.
Right.
So you really can't use it because there's no specialists who are in the network.
Yeah.
Yeah.
It's kind of a catch-22. Sure, you can do chiropractic.
Yeah. Just find it.
Pick from our list of 0.
Yeah. Pick from the list that has no one. Yeah.
So
And
what I've been contacting chiropractor offices and offering to send them the sign up information for my insurance. I got the sign up information, and some of them are with a partner company, but not with my company because my company is specific to my work. I found this out when I called the insurance company. They said UC won't allow, or my employer won't allow that, and transferred me to them.
Yeah.
So the phone networks are connected. That's how connected they are. So that kind of bothers me. But I can't do anything
fighting
about
City
it.
Hall there.
Right, I'm fighting City
They're all
Hall
wearing
there.
red hats.
Oh,
Yeah.
yeah. That definitely. There's always challenges when it comes to trying to go a different route for your wellness, and that's when the stop signs are put on our faces. But
Yeah, and especially in Western medicine. I
Oh
would
my God, yeah.
think that my hospital, my major university hospital in Cincinnati, Ohio, enough information. They do have I wouldn't call it a holistic health, but they have a natural health. They're grasping at it more. They're accepting it more. They've added on practitioners who actually do. They have to be a registered doctor. They can't just be a holistic healer.
Right.
But, many of the doctors at University Hospital have looked into. My own doctor is really into, less medical information not information. So that said, I mean, he does tie-dye, eats granola,
So he's open to
yeah, he's very open to alternative medications.
Yeah. That's always a
that's
good
nice.
thing.
Yeah.
Yeah.
He's a good guy. He's my doctor.
Yeah.
Yeah. Oh, that's good.
So we should say, do you want to plug your book? I know
Oh,
you have
yeah.
a book, right?
Mhm.
Yes. I have a book that I co-wrote. It's called Impact Leadership with Blanca E. Rodriguez. And basically, I co-wrote this book with 29 other book co-authors from all over the world, from all walks of life. And here we have something in similar. We have something in common, all of us in this book, and it's telling our stories of our lives in one chapter, stories of going downhill, facing very difficult and dark seasons in our lives, and coming out to the other side with hope, resiliency, and never giving up. So it's a wonderful book of personal growth. I highly recommend it. And I am in Amazon Kindle and paperback as well.
Awesome.
Thank you.
Um, Also, we should note that you kind of specialize in helping patients over 55, senior.
Yes. I'm a group fitness instructor for population over 55. I am a Zumba instructor. I've been into group fitness. I've been teaching some sort of group fitness or dance instruction for over 42 years already, and I'm very blessed and lucky and grateful to be still teaching to this day. And with this powerful practice, it really helps people have better quality of life. And here in Florida, this is the land of people that retired, and a lot of people that retire, there's a lot of widowers, there's a lot of women that have lost their husbands. They don't have their they don't have their family here in Florida, and it's an excellent way not only for them to stay physically active, but it helps them with their social skills. It helps them to develop more of community. And so it's a beautiful thing. It has tremendous great effects on them always. I had this lovely lady that I used to teach her group fitness instructor in a pool. It was pool class, and pool class is a very powerful practice, very powerful fitness activity for anybody, because it's not a high impact exercise, but is very effective. And one of these ladies, I consider her one of my guardian angels, she went to surgery for open heart surgery, for just to change a valve or something. Well, she had quadruple bypass surgery. It was messed up in there, and the doctor told her that thanks to her physical activity, thanks for her being in her pool classes, she had more chances of survival, and she did survive the surgery thanks to, and the doctor says, like, this is unbelievable. We didn't know how bad this was, but thanks to her physical activity, she survived it. So that is one of the many great stories of survival from people that go through these situations. They had accidents, they have arthritis, they have whatever the case may be, that they cannot walk, they cannot run anymore. Pool physical activity is highly recommended.
Yeah.
Definitely.
But we belong to a gym, and
Yeah,
Lisa did
well,
well.
we're actually getting ready to change gyms. Although we're having some financial glitches right now, so and gyms can be very expensive, and that's the only
Mhm.
way I can get into a pool
But you
here
couldn't get
in
into the pool because it
Cincinnati.
was so loaded all the time. There's so many. I mean, the
Well,
pool was
yeah.
at the gym we went to. The pool was like always.
There's always full of people.
Yeah,
Well,
it's like
and
Mm.
the problem is there was only like the one pool, and you had people trying to do laps during the classes.
Oh, yeah.
The classes would go from like 3 people to 30 people, depending on the given day and time.
But long story
And
short,
I
it was
ended
very
up
popular.
kind of coming
Yeah,
up
it was
with my
very.
own routine that was really working until I ended up in the hospital with another skin condition. So they told me I could
Mm.
be in the pool for a little while, and it kept going back and forth with that.
But it was
Yeah.
So I
popular. It's
do want
like
to get back into
Hmm.
for sure.
that's
It
a
was
very
very
popular
popular.
exercise
Yes.
thing.
Yeah. It's a very popular exercise because it's so effective. It's low impact, but it's still a very powerful form of
Right.
physical activity. Hmm.
So I'm trying to get into a place now that has, I believe they have 2 pools.
Yeah. Okay.
I'm trying to do that. And then, there's some other things I'm looking into, but I do want to get back into pool fitness because I was up to the point where I could jog for 15 minutes in the pool.
Love
And
it.
people put down pool exercise, but the pool is resistance.
Well, I keep thinking of that.
And I also have the weights, I have the shoes, I have the outfit with the short sleeves and the shorts that go down to your knees.
Do you remember that
Mm.
Sports Illustrated where it shows Ali getting ready for
Uh-huh.
the fight with Foreman or somebody?
Yeah,
Mhm.
Oh, and he exercised apparently
in
in
the
the
pool.
pool. You know,
Yeah, absolutely.
just
Absolutely.
And it's
water.
It's great
really
for resistance. It's great for resistance training, actually.
Yeah.
it is.
Yep. Hmm.
Yeah, definitely.
Well,
Mhm.
so
Oh, and you can take your resistance bands in the pool.
Right. Hmm.
right.
Yeah.
So we do I don't know if you'd be interested in this or not, but we do a game at the end of our episodes, and it usually takes 5 to 10 minutes.
Hmm. It
Um,
actually takes longer to explain how it works, but it's like a Marion versus Ginger situation.
Oh, okay.
that,
Sure.
we call it our Elite Eight mini bracket.
Okay.
And the topic that we chose for this one was movies about holistic health. These are popular movies about holistic.
Okay. Interesting.
We'll list the movie, and then we'll try to indicate what aspect of holistic health is represented in the movie, just in case you hadn't seen the movie. But you may have strong opinions after having seen the movie. So,
Right.
Okay.
And not all of these are, some of them are just like self-help healing or meditation. It's not all about seeking like a different type of medication. It's, I mean, obviously we have Lorenzo's oil on here, but spoiler alert.
do you want to do the hosting or do you want to do the voting?
I don't, which do you prefer?
I'll do the hosting because
Okay.
see what kind of opinions you
Because
have.
I've
I
actually
keep turning my head to look at my grandson's team's little league game.
Yeah,
Oh, that's nice.
They're,
Good for
they're winning.
you.
They're winning 11-4, but he's actually
Ooh.
sick and not playing today.
Oh.
Aaron recently moved 2 hours away from where he used to live, which was much closer.
Yeah.
So, I mean, he used to
Yeah, I
be
used to go to all the games. Now I have to watch them.
Oh.
right.
Mm.
well, he's
But
actually
it's nice that you can watch them.
Yeah.
podcasted from the field before. So
Yeah.
Yeah, I have.
He's very involved in his grandboys.
right,
Good.
good example of a good grandpa. So
Absolutely.
all right, so here we go. The first matchup is Man on the Moon, which was about Andy Kaufman's cancer treatment. We sought some holistic, remedies versus Eat, Pray, Love, which kind of highlighted meditation. Which of those two films do you prefer, Blanca?
I've only
far as,
seen one
like-
of them, so I have to vote for Man on the Moon.
Okay.
I definitely vote for Eat, Pray, Love.
Okay. Lisa,
Yeah.
tiebreaker.
Hmm. Yeah,
Uh,
definitely.
I kind of think that if you start with meditation, then maybe, I don't know, maybe if he'd been meditating, he'd have been more aware of himself and maybe he'd have known about the cancer sooner.
Yeah.
So
Mhm.
I think I'm going to go with Eat, Pray, Love too.
All right.
Okay.
All right. Second matchup of the first round is Bucket List, about self-healing. A couple of
As you face the end of life.
cancer patients go on a journey to experience things that were on their bucket list of things
Hmm.
past. Versus My Life, which concentrates on acupuncture.
Okay.
That was with Michael Keaton. I don't know if you saw that.
I think I saw that
Is
movie
that the one where Michael
once.
Keaton was dying and he made a video for his not yet born son?
I think so,
yeah.
yeah.
I've
I
seen that
think-
one and I haven't seen the other one, so I guess I'll vote for that one.
Okay.
I definitely love The Bucket List.
Okay. So
Yeah.
Lisa,
Who's in the bucket list?
Jack Nicholson and Morgan Freeman. I watched that movie many times, and I'm a huge fan of that movie. That movie is a powerful, beautiful movie of, okay, we got a certain time in our lives to do this. The end is coming. Why not embark into something that we really wanted to do. And it was literally that, the bucket list.
Yeah.
Mhm.
It's common.
That's how it became part of. I mean, the bucket list existed before the movie, but the
Mhm.
movie made it
Right. Everybody knows
Oh
it's
yeah.
a cultural phenomenon.
Yeah,
It,
yeah.
it made
Everything
it made
started
the
to
phrase
look.
popular.
Yeah, well, everybody started to look at the bucket list with a whole different mindset because we have. I mean, I have had bucket lists like many times, but my bucket lists were like really shallow in comparison to the movie. That's for sure.
I think what your bucket list is what you need, and it might even be what you need in that moment. You know,
Right.
not facing the end of your life, your bucket list would probably be a little more shallow.
Mhm.
Blanca has about 7 more minutes, guys.
Okay.
all right. So what do you
Oh,
vote for?
bucket list.
Okay.
I'm gonna have to go with the bucket list too. I've seen both movies, and bucket list made more of an impact.
All right.
I'll have
Yeah,
to check that one out.
I agree. Oh yeah, you should. You should, Aaron. Definitely.
Lorenzo's Oil versus Doctor Strange. At least
Wow, I don't remember Lorenzo's Oil.
I didn't see Lorenzo's Oil.
I don't think I have seen that one.
Doctor Strange definitely had the alternative medicine going on. I'll go
Hmm.
Doctor Strange. I did see
Yeah.
that one.
I'll go to Doctor Strange too.
Okay.
So far, I've seen one of the two in each one.
Right.
Lorenzo's Oil is where these parents find this oil that can help their son and other children who are dying to keep them from dying. They're literally told he's going to die, and all they need it's similar to the thing where it's similar to what Libby dealt with.
Oh,
We have a friend,
Mhm.
Libby, who was born with no thumbs, and she had I can't remember the name of what she had,
ALD.
but she was the first person to live past the age of like 13 with this
Mhm.
illness, and she was actually on the Phil Donahue show.
Wow.
But that's beside the point. Lorenzo's Oil is this basic oil that needed to be developed, and the drug companies would not develop this because there weren't enough people with this illness, and these kids were dying from it.
It wasn't profitable enough for them.
Right,
Exactly.
profitable enough.
So
Just like massage therapy.
Lorenzo's Oil,
all right, but it's Doctor
okay,
Strange.
but Doctor Strange is moving on, and I'm
Okay.
okay with that.
Okay.
Yeah.
Okay.
All right. So our last matchup of round one is Dallas Buyers Club versus Awakenings. Buyers Club was about AIDS treatment that was unavailable in America and seeking that treatment internationally. And Awakenings is about a doctor played by Robin Williams converting a medication for Parkinson's disease to treat people in a catatonic state or catatonia.
It was a form of encephalitis that
Yeah, yeah. I watched both movies, very powerful, and I'll go with Awakenings.
Okay. Aaron?
I think I saw Awakenings a long time ago. I'll vote for that one.
Okay, so it goes through. What do you say, Lise?
I mean, I want to throw a vote to Dallas Buyers Club just because I want every single movie. All the movies on this list are powerful and healing.
Right.
Okay, so it's kind of So I'll just give them a vote just to give them a vote.
Okay.
The movie did well at the Oscars, didn't it?
Oh yeah, it sure
Yes,
did.
very.
Mhm.
We're down to our final four here. Eat, Pray, Love versus Bucket List. Why don't you go first, Lise?
Oh, definitely bucket list.
Bucket List, okay.
I'll go for bucket list.
Bucket List, good.
Make it a sweep. I haven't seen either one,
So we got our
but
champions,
I think I'm more encouraged to see Bucket List than the other.
Doctor Strange versus Awakenings.
I'll go for Awakenings.
Okay. Lise?
I'm gonna go for Awakenings too.
All right. Aaron? Sweet.
I barely remember Awakenings, so I'll go Doctor Strange.
Okay. Awakenings wins. So now we got our championship. Here we go. The tip off. Monday night, 7:30, whenever they play that tip off. Here we go. Bucket List versus Awakenings.
Bucket list.
Okay.
Bucket list.
Yeah,
We have a
Bucket
champion.
List.
Bucket List. Morgan Freeman is awesome. I gotta
Oh
say,
yeah,
my favorite.
powerful.
Blanca, do you want to plug your social media handles and websites and anything else
Oh,
before you
yes,
go?
absolutely. Thank you so much. Yes, everybody, you can find me on my website, www.woundedhealer.us, and I am in all social media sites. I am as woundedhealer.blanca E. You can find me there on Instagram, Threads, TikTok, Facebook, you name it.
All right.
And we're going to
Excellent.
repeat that Wounded Healer LLC is her business.
Hmm.
I do want to ask one last question.
Of course.
Is there anything that we did not talk about that you'd like to at least mention?
Oh, no, not at all. This has been a wonderful conversation. Definitely. Thank you so much for having
That's
me.
our goal. Conversation.
Yes, absolutely.
Oh, this game's a lot closer. It's 11-7 all of a sudden.
Oh boy. Come back. All right. You have a great day.
Thank you.
Nice to
Thank
meet
you,
you, Blanca.
everyone.
See you
Nice
guys.
to meet you, Erin. Take care,
Bye,
Lisa
everybody.
and Phil.
Nice to meet you.
Bye.
Bye-bye. Take
We have
care.
social.
Twitter,
Yeah, pod.
Instagram,
Yeah, pod.
Facebook.
Yeah, pod. So let us know. Hit us back. Have a great week.